3 in the morning. Your foot locks into a cramp. You chalk it up to age and fall back asleep. But in that moment, your body was sending a specific warning about blood sugar that no lab result had found yet. I want to come back to that moment at the midpoint of this video, because the explanation changes how you understand everything else we are about to cover. I have spent months reading clinical studies that sit behind paywalls, research in specialty journals that most physicians simply do not have time to open. What those studies show, consistently, is that elevated blood sugar begins registering in the feet long before it appears in blood work. Your feet are the body's earliest warning system for blood sugar problems. That is not a metaphor. That is what the research confirms. Today I am counting down 5 of those signals, starting with number 5, the one most easily dismissed, and building toward number 1, which I believe carries the highest stakes of any sign on this list. This video is about 25 minutes. The most important part comes in the second half. Please stay for all 5. As we move through the countdown, hold 3 things in your mind. The sign at number 1 has a direct connection to whether you keep your independence as you age. I will tell you exactly what that connection is at the end. I will also give you an answer, before this video closes, to one question that no patient brochure I have ever read has addressed. Why does the body route these warnings through the feet first? That answer matters more than most people realize. Have you ever noticed something about your feet that your doctor brushed off or simply never explained? Tell me in the comments below. I read every single one posted here. Now, number 5. It is 2 or 3 in the morning. A cramp seizes your foot or your calf without warning. The muscle clenches hard, holds for 15 seconds, 20 seconds, then slowly releases. You sit on the edge of the bed rubbing your leg, running through the usual explanations. Not enough water, too much walking yesterday, just getting older. Occasional cramps from those causes are real, but there is a specific pattern that deserves a different explanation. Cramps that come several nights a week, that strike the feet and lower legs rather than the thighs, that no amount of extra hydration seems to prevent. That pattern is worth understanding on its own terms. Here is the mechanism the research describes. When blood sugar is elevated over a sustained period, the kidneys work harder than they should. They are continuously trying to clear excess glucose from the bloodstream. And in performing that clearing, they also pull out 2 minerals that your muscle cells depend on to contract smoothly and release cleanly: magnesium and potassium. When those minerals fall below what the tissue requires, muscles misfire. They seize involuntarily in the night. The technical term is electrolyte depletion, secondary to glucose-driven osmotic diuresis. In plain language, excess blood sugar is draining the minerals that keep your muscles quiet while you sleep. Think of your muscle fibers like violin strings. Properly supported with the right mineral tension, they vibrate and release. When that support is consistently depleted night after night, the strings go rigid and snap at unpredictable moments. That snap is what wakes you up. A 2017 study published in PLOS One, conducted by researchers at the University of Arizona and Harvard Medical School, analyzed health data from a nationally representative sample of American adults and found that elevated HbA1c, the long-term blood sugar marker your doctor checks to screen for prediabetes, was significantly associated with frequent nighttime leg cramps, independent of age and other health conditions. Seeing blood sugar appear specifically linked to foot and leg cramping in such a large population-based sample confirmed what many clinicians had been observing for years without a clinical trial to point to. The most common mistake is reaching for a banana when the cramps begin. Potassium helps, but the mineral most adults over 60 are genuinely deficient in is magnesium. Magnesium glycinate, 300 milligrams taken 30 minutes before bed, is far better absorbed than the magnesium oxide found in most budget supplements. If you are on kidney medications or blood pressure medications, speak with your physician before starting any mineral supplement. Reduce sugar and refined carbohydrates specifically at dinner. What you eat between 5 and 9 in the evening directly affects the mineral balance your muscles face at 3 in the morning. Within 2 to 3 weeks of making both changes, most people report fewer nighttime cramps. Within 6 weeks, the pattern can shift meaningfully. The sign at number 4 is something you have probably looked at 100 times without understanding what it was signaling. It shows up on your toenails. If you found this video through a search today, you may not know this resource exists for you every week. I post new health information specifically researched for adults over 60, and I post it every single week. Press the subscribe button just below this video right now. Think of it as setting up a standing health appointment, one that comes to you rather than the other way around. There is no cost, and missing the next video means finding it much later, if at all. Pull off your socks right now, or picture doing it. Look at your toenails, specifically the big toes and the ones beside them. Are any thicker than they used to be? Yellowed or brownish? Do any crumble slightly at the edge when you press them? Have you been told it is just age, that nails naturally thicken as the years go by? Nails do change with age, but there is a specific pattern of thickening, discoloration, and soft crumbling at the nail edge that has a name and a biological cause. That cause is connected to blood sugar in a way most patients I treated over decades were never told. When blood sugar is elevated, two things happen that make your toenails a uniquely vulnerable target. First, glucose moves into the moisture and secretions surrounding the nail bed and creates an environment in which fungi actively thrive. Fungi use sugar as fuel. Elevated blood sugar is literally feeding the organisms that are breaking down your nail tissue from below. Second, high blood sugar suppresses the neutrophils, the frontline immune cells your body depends on to fight fungal invaders. The entry door is opened, and the security system is disabled at the same moment. Think of your toenail bed like a garden plot. Under normal conditions, that soil is not particularly hospitable to fungal overgrowth. But flood it with a steady supply of glucose and disable the organism that does the weeding, and fungi take hold within weeks and spread steadily for months. A 2023 systematic review published in Mycoses, one of the leading peer-reviewed journals in clinical mycology, found that people with diabetes face approximately 3 times the risk of developing toenail fungal infections compared to people without diabetes. Not slightly elevated, 3 times. And because the same immune suppression and circulatory changes that made the infection easier to contract also make it harder to clear, these infections persist and worsen over years, while the person assumes it is just an aging nail. The most common mistake is treating this as cosmetic. Tea tree oil, antifungal nail polish, filing down the nail. These address the surface. They do not address the blood sugar environment that is continuously inviting the infection back. Inspect your toenails under good lighting tonight. Look for thickness, yellow or brown discoloration, soft or crumbling edges, or any separation of the nail from the nail bed. If you see more than one of those signs, note it and bring it to your next appointment, not as a cosmetic concern, but as a metabolic one. The sign at number 3 is one I expect will surprise you. It looks harmless. It looks like something you may have had for years. You may be looking at it right now without any idea of what it actually means. You have just received 2 pieces of information that most people living with these exact signs have never been given. Here is a third that belongs in this conversation. Researchers studying the timeline of these foot changes have found that fungal nail infections in people with elevated blood sugar tend to develop and worsen more aggressively than in the general population, partly because the nerve damage that often accompanies elevated glucose means the person feels less of the pressure and discomfort that would otherwise prompt them to act sooner. And coming up at number 3, a sign so familiar, so easy to dismiss, that most doctors never even ask about it, and what it is silently indicating about your body's relationship with insulin. If you have stayed through 2 signs already, you are doing real work for your health right now, and I want to acknowledge that. It takes more than most people give. Press the like button right now. It is an easy way to bookmark this video so you can find it again and share it. We have covered nighttime cramping connected to mineral loss from elevated glucose, and toenail changes connected to a fungal environment that high blood sugar creates and feeds. And here's the resolution of something I promised at the very start. That cramp I described at 3 in the morning? That was your kidneys flushing glucose and pulling your minerals with it. Now you know exactly what your body was trying to say. What is still ahead includes the most overlooked sign of all, and the finding behind number 1 that I believe every person over 60 needs to hear. Stay with me. Coming up very soon, I will be covering the early warning signs of kidney stress in adults over 65, a topic I see misunderstood constantly in my comments section. If you want that video sent directly to you when it posts, press subscribe just below this video. It takes 5 seconds and there is no cost. What your kidneys are telling you about your blood sugar may be the most important connection you learn all year. Look at the sides of your feet, your ankles, and the skin folds around your toes. You may see small, soft growths, flesh-colored or slightly darker, raised, hanging from a narrow stalk of skin. Some people have one or two. Some people have a dozen. They have probably been there so long that you stopped noticing them. Most people have been told they are harmless. Most people have never been told what causes them. In more than 3 decades of practice, I noticed that patients who came in with multiple skin tags, particularly when they were appearing in new places on the body, were disproportionately the same patients whose blood work showed elevated fasting glucose or insulin resistance. I began asking about this directly. The research confirmed what I was observing in the clinic. Skin tags are driven by insulin-like growth factor 1, a compound abbreviated IGF-1. When the body produces excess insulin, which is precisely what happens in the years before full diabetes develops, that insulin overstimulates cell growth receptors on the surface of skin cells. The outer layers of skin begin multiplying faster than the body's normal turnover rate supports. The excess tissue piles up in small clusters. Think of it like a construction crew that was never given the order to stop. The extra material accumulates. That accumulation is a skin tag. It is not random. It is a direct cellular response to too much insulin circulating in the bloodstream. Research published in the International Journal of Dermatology in 2007 by Rossi and colleagues examined more than 100 patients with multiple skin tags alongside a matched control group. The finding was striking. Patients with skin tags had nearly 3 times the rate of diagnosed diabetes compared to the control group, 23% versus just over 8%. The greater the number of skin tags a patient had, the stronger the association became. The most common mistake is dismissing these as an aging skin issue. They are not. They are the skin responding, at the cellular level, to insulin levels that have been elevated long enough to activate growth pathways that would not otherwise be active. Tonight, look at your feet and ankles under good lighting. Look also at the inner sides of your knees, the undersides of your upper arms, and the back of your neck. Multiple skin tags in multiple locations, particularly new ones that have appeared in the past 2 years, are worth a fasting blood glucose test. You do not need to wait for a doctor to notice them. Number 2 on this list involves a different kind of skin change that is even more specific in what it reveals. I want to ask you something directly right now. Have you ever noticed small, soft growths appearing on your feet or ankles in recent years? Ones that just seem to show up on their own? Tell me yes or no in the comments below. I personally read every comment on this video, and I will respond to as many as I can. You now understand more about the feet as a blood sugar warning system than most people learn in a lifetime of medical appointments. Here is one additional fact worth holding on to. Several studies examining the timeline of these skin changes have found that skin tags and the darkened skin changes we are about to discuss tend to appear on average years before a fasting blood glucose test crosses into the pre-diabetic range. The blood test is catching up to what the body has already been saying. And the sign coming at number 1, which I have been building toward from the beginning, is the one that changed how I think about what elevated blood sugar costs people most. You have made it this far, and I want you to hear this clearly. The fact that you are still watching tells me you take your health seriously. That matters. Subscribing is not a social media action. It is how you make sure the next piece of information I put out finds you instead of a stranger. Press subscribe. It is free and it takes 10 seconds. Look at the back of your neck, the skin under your arms, and, less commonly but meaningfully, the top of your feet near the ankles and the skin folds between your toes. You may notice patches that are darker than the surrounding skin. Not tanned, darker. And if you run a finger over them, they feel different from the skin beside them, thicker, slightly elevated, with a velvety texture that does not change with washing. Most patients I have seen with this finding believed it was sun damage, age-related darkening, or simply the way their skin happened to be in that spot. Some had tried whitening creams for years without effect. That is because this sign is not a pigmentation change on the surface. It is a structural change in the skin itself, and it is driven by excess insulin. The condition has a name, acanthosis nigricans, and it follows a specific biological pathway. When insulin levels are chronically elevated, insulin interacts with receptors on skin cells called insulin-like growth factor receptors. Those receptors trigger the outermost skin cells, the keratinocytes, to divide and multiply faster than normal. The result is a thickened, darkened patch with that characteristic velvety texture. No cream reverses it because the cause is not on the surface. The cause is in the bloodstream. Think of it like a printing press receiving the wrong signal. It keeps running, stacking extra layers of paper in one spot, building up and up. The darkened, velvety patch is what happens when cells that should stop growing have been told, by excess insulin, to keep going. A 2010 study published in the Journal of the American Board of Family Medicine, conducted through a national network of primary care practices under the PrimeNet Research Consortium, examined over 1,700 patients and found that patients with acanthosis nigricans were approximately twice as likely to have type 2 diabetes as patients without it, even after accounting for age, body weight, and other known risk factors. Twice as likely, visible on the skin, detectable with a careful look. This sign can appear years before a fasting glucose test becomes abnormal. That is the point. The skin is doing the warning that the blood test has not yet caught up to. Look at those areas of your body tonight. If you find the velvety darkening in more than one location, add it to the picture you are building of your own risk. And stop treating it as cosmetic. It never was. Number 1 on this countdown has nothing to do with how your skin looks. It is about what your body can no longer accurately feel, and why that matters more than almost anything else on this list. You reached for something on a high shelf and felt a sudden moment of uncertainty about where your feet actually were. Or you stepped off a curb and your ankle turned slightly, not because the surface was uneven, but because your body responded a half-second late. Or you stood up from a chair and needed to pause, one hand on the armrest, longer than you remember having to do 2 years ago. Most people file those moments under the same folder: getting older, blood pressure dropping on standing, maybe the inner ear. And sometimes those explanations are accurate, but there is a specific pattern of increasing unsteadiness, at the ankles particularly, worse in dim light or on uneven surfaces, that is directly connected to blood sugar and to a biological system most people have never heard of. Your joints and the muscles around them contain microscopic sensory fibers called proprioceptors. They are the nerve endings that tell your brain exactly where your feet are in space at every moment. The precise angle of your ankle, the pressure distribution across your sole, the micro adjustments happening continuously without any conscious effort from you to keep you upright. This system runs silently below your awareness. You have never had to think about it. You have been relying on it every second you have been standing or walking for your entire life. When blood sugar remains elevated over months and years, it damages these small sensory fibers. They lose their precision. The signals they transmit become vague, delayed, or incomplete. Your brain, receiving imprecise information about where your feet actually are in space, has to compensate. And in adults over 60, that compensation increasingly falls short. Balance deteriorates quietly. Falls become more likely. And because no physician connects ankle wobble to blood sugar during a 15-minute appointment, the root cause goes unaddressed for years. A 2025 study published in Frontiers in Aging Neuroscience found that elevated HbA1c levels were significantly and moderately correlated with proprioceptive errors at the ankle joint, with a correlation coefficient of approximately 0.54, and with overall postural instability at 0.65. The higher the long-term blood sugar, the greater the measurable error in the body's sense of where its own feet were. Higher blood sugar, more balance errors. A direct, quantified relationship in older adults with type 2 diabetes. The most common mistake is attributing all of this to the inner ear or to general aging. Inner ear problems tend to cause spinning, nausea, and positional symptoms. What I am describing is quieter and more consistent. A subtle unreliability when stepping, a hesitation before moving on uneven ground, a growing unconscious reliance on walls and handrails that you may not have fully acknowledged yet. 2 practices address this directly. Stand on one foot each morning for 30 seconds, switching sides, using the counter only if you need to. This is not just exercise. It is active maintenance of the very nerve pathways involved in positional balance. The second is addressing blood sugar at the foundational level, consistent protein at every meal, substantially reduced refined carbohydrates, and a 20 to 30 minute walk daily. Within 6 to 8 weeks of blood sugar stabilization and daily balance practice, many people notice measurable improvement in their stability. The damaged nerve fibers can partially recover when the glucose environment improves. That recovery is documented, it is real, and it is available to you. Let me give you a practical morning to evening plan starting tomorrow. Morning, when you first get out of bed. Before you stand up fully, flex both feet and rotate your ankles 10 times in each direction. This takes less than a minute and gets blood and mineral supply moving into the tissue before you put weight on it. While you make your first drink of the day, practice standing on one foot for 30 seconds on each side. Hold the counter lightly. The goal is to gently challenge your balance system every morning, rather than letting it weaken passively. For breakfast, prioritize protein. Eggs, plain Greek yogurt, or smoked fish are excellent choices. A high-protein breakfast stabilizes blood glucose through the morning and reduces the mid-morning sugar spike that many people do not realize they are experiencing. With your evening meal, take magnesium glycinate, 300 milligrams, 30 minutes before eating or immediately after. This timing supports mineral replenishment through the night, when glucose-driven flushing is most active. If you are on ACE inhibitors, potassium-sparing diuretics, or kidney medications, speak with your physician first about the appropriate dose. Cut all sweetened beverages entirely. This includes fruit juice, which carries as much sugar per ounce as a soft drink. Water, herbal tea, and black coffee are your evening choices. For weeks 1 and 2, focus on just 2 changes, the magnesium and the evening sugar reduction. Do not try to overhaul everything at once. In weeks 2 through 4, add the daily single-leg balance work. In month 1, book a fasting blood glucose test. Not this month sometime, this month specifically. The test costs very little and is covered under Medicare for most of you. If you found multiple signs from this video in your own body today, 3 or more, I want you to make that appointment before the end of this week. Not because any one sign is a diagnosis, none of them are, but because patterns matter, and 3 or more of these signs appearing together in the same person is exactly the kind of pattern that deserves a direct conversation with a physician. One important warning: if you are already on a diabetes medication, such as metformin or insulin, do not adjust your dosage based on any dietary change without informing your doctor first. Blood sugar medications are calibrated to your current diet. A meaningful dietary improvement without medication adjustment can cause blood sugar to drop lower than intended. A month from now, if you have applied even 2 of the steps from this video, you will likely feel something specific: a quieter night, a more confident step, and a sense that you are operating with information your body has been trying to give you for a long time. I want to tell you something I have never put in a video before. Early in my career, a patient of mine, a retired school teacher, sharp, careful about her health, came in and fell during the examination. A simple step backward toward the exam table, and she went down. She had been to 3 physicians in the previous year for what she described as feeling uncertain on her feet. She had been told it was her age. It was not her age. Her HbA1c came back at 9.1. She had been living with uncontrolled type 2 diabetes for over 2 years. Her proprioceptive system had been silently compromised the entire time. She recovered well, but she lost a year of stability that she did not need to lose. I think about her when people tell me that they feel dismissed by a medical system that moves too fast to look carefully at what the body is already showing. If that is your experience, if you have brought concerns to a physician and walked out with nothing but a pamphlet, I want you to know that your experience is real, your body's signals are real, and the information in this video comes directly from published medical research that supports taking those signals seriously. Here is what I believe more than almost anything I learned in 35 years of medicine. Independence is not given, and it is not taken. It is maintained through small decisions, consistent habits, and knowledge that gets acted on rather than filed away. You now have 5 specific things to look for on your own feet tonight. That knowledge belongs to you. The sign at number 1, the proprioceptive loss I described, is the sign I think about most when I consider what elevated blood sugar ultimately costs people. It does not take vision. It does not take memory. It takes the quiet, invisible system that keeps you upright, moving freely, and living on your own terms. And it takes it slowly enough that most people never notice until a fall makes it impossible to ignore. Do not let the slow pace of this loss fool you into believing it is not happening. It is measurable. It is connected to blood sugar, and it is, in significant part, reversible. Go look at your feet tonight. That is all I am asking. 30 seconds in good light. Whatever you find, now you know what it means. Tell me in the comments. Of the 5 signs we covered today, did any of them describe something you have already been living with? Even one? I want to know. I am also working on a video about a finding in the research that surprised even me: the relationship between the timing of your largest meal of the day and your fasting blood sugar the following morning. What most people eat for dinner is working against them in ways they have never been told. To make sure that video reaches you when it posts, tap subscribe just below this video right now. It is completely free, and it is how YouTube delivers it directly to you. That meal timing finding alone could change something you do every single evening. We covered 5 signs today: nighttime foot and calf cramping, toenail changes from fungal overgrowth, small fleshy skin tags around the feet and ankles, dark velvety patches driven by insulin resistance, and the quiet deterioration of balance and joint position sense from small fiber nerve damage. Each one points to elevated blood sugar through a completely different biological pathway. Each one is visible or felt, and each one can be acted on. If any of what we covered today sounds like something a person you love is experiencing, a spouse, a parent, a sibling, please share this video with them today. Everything in this video is for educational purposes only and is not a substitute for personal medical advice. Please speak with your own physician before making any changes to your medications, supplements, or health routine. What works for one person requires individual medical judgment for another. Your doctor knows your full picture. I only know what the research shows. Use both.